am Dr. Aditya Jindal. I am a chest specialist and today I will be demonstrating to you how to use a Turbuhaler device for asthma and COPD. So this is a device which contains medicine in powdered form which can be used to treat these diseases like asthma and COPD. This is a demonstration device, so it is transparent. The device which is available in the market is in a sort of a white or cream colored form, so it will be slightly different from what is shown here, but the overall shape and every other functionality is the same. So first I will show you how to use this device. So once you receive the device, you have to unscrew the cap, remove it, there will be a small rattling noise which comes, then you have to keep the cover at the side. Before using the device, we have to load the powder in the machine. So for doing that, first we have to twist the disc at the bottom in a counterclockwise direction and then turn it back in a clockwise direction. So I'll just do that to show you how it is done. So first we'll do it in one direction and then twist it in another direction. So we'll hear a small click that is coming out. When the click is heard, it means that the device is ready to use. So before using this device, what we have to do is that we have to sit properly, keep our feet firm on the ground and sit in an upright position like I am sitting now. Exhale to empty the lungs, then keep the device in the mouth, hold it with the teeth and with the lips, and then take a long and deep forceful inhalation and then hold breath for at least 10 seconds. So I'll just demonstrate it now. So first I'll just do it again just to show you it should not be done practical thing because we've already loaded the device. So twist in one direction, twist back, you've heard the click sound, sit properly, upright position, then exhale, put the device in the mouth, then hold the breath for 10 seconds. So I'm not doing that because I'm not taking the medicine as such, but this is how it is done. So then you can just recap it and then keep it at the side. So I'll also share some additional information about this device. One is that there is no taste in a lot of inhalers of different manufacturers, so you can feel some sort of taste which is coming in the mouth. With this device there is no taste. This is because the particles are ultra fine and they go directly into the lungs, so we will not feel any taste in the mouth, so there is no problem in that. Second is that there is a dose counter. So this is just to show the number of, it's a disc marked in red, and this is just to show the number of doses which are left in the device. So normally this has 60 doses and your doctor will prescribe you how many doses to take or how many times this has to be taken in a day, and according to that the number of doses are left. The dose counter does not move individually with each inhalation. It only moves after 20 sort of inhalations are done. So don't expect that if you are taking one inhalation, the dose counter will move maybe from 59 to 58 or from 40 to 39, those kind of things. The last point is that there is some sort of when you shake it, you can feel that there is a small sound which is coming from the bottom of the device. This is the desiccant which is used to absorb the moisture so that the powder remains for inhalation, useful for inhalation, and one should not think that the device is broken or there is any problem with the device. So I think that's all, and I would like to say that use your inhaler regularly so that your disease remains under control. Thank you.